What we're going to do now is to show a demonstration of doing a behavioral risk assessment without the complete sexual history that you saw in the first demonstration. So this will be a behavioral risk assessment that consists of the nature of the current sexual relationships, the number of partner for the patient and her partner or partners, and then again, history and attitudes towards substance use, including alcohol use, HIV testing, and condom use. So Tess, I know you're here because you think you have a yeast infection.
Yeah.
And we have a specimen, in the lab looking to see whether there's yeast there or not. And if so, we'll give you some treatment today.
Okay.
Okay, but while you're waiting, why don't we talk a little bit about your partner situation?
All right.
Can you tell me your partner situation right now in terms of sexual partners?
Well, sure. I actually just met a new guy 4 months ago.
Okay.
And things are going great.
Okay.
Yeah.
So you've been with this one guy for 4 months?
Yeah.
Okay. And you say going great. What's that relationship like for you?
Oh, he's wonderful.
Okay.
We have decided to be mutually exclusive. And he's just a really great guy.
Okay.
We're having a lot of fun together.
Good. Good.
Yeah.
And when's the last time they had sexual contact with him?
Oh, probably 3 days ago.
Okay, good. And how about with somebody other than him?
Probably 6 months ago.
Okay, okay. And so just this one partner in the last 3 months?
Yeah.
Okay.
Yeah.
And how about for him? What's his situation?
I don't know.
Okay.
I mean, I don't know.
Okay. So you said you've decided to be mutually monogamous. So what does that
Yeah.
mean for you? What do you think that means?
And that means that I am just with him.
I got you. Okay.
Yeah.
Okay. All right. So in terms of thinking about other things relative to what's going on with the two of you, tell me what's happening in terms of any alcohol or drug use.
I drink alcohol on weekends. When I'm, not working.
Right. Okay. How about for him?
Oh, he drinks alcohol.
Okay. And how about other drugs?
I'm really not sure.
How about for you?
Oh, none.
None.
No.
Okay. Okay. Not sure for him?
I don't think he does.
Is it something you've talked about ever
Well,
with him?
yeah, we just don't normally. I mean, I don't do drugs. He's never done them in
Right.
front of me, so
Okay.
I just assume that he doesn't do them.
Okay. And how about in terms of getting an HIV test, like for yourself? Have you ever had that done?
Gosh, I don't remember the last time.
But you maybe have had, what do you think, or no?
Would I have gotten one at my doctor?
Not unless they talk to you about it.
Oh, yeah.
So maybe never?
Maybe.
Okay. And how about for him? Is that something you've ever talked with him about?
Actually,
his
we
HIV?
haven't.
Okay.
No.
Okay, so don't know his HIV situation. Okay. And then how about your experience with using condoms?
Oh, well, we don't because I'm only with him. So.
Okay. Okay. Have you used condoms in the past with other partners?
I did with the partner before him, the guy I dated last year.
Okay.
So I have used them.
Have
Yeah.
used them? Okay, you've been able
Yeah.
to use them successfully? Like, you know how to use
Yeah.
them?
Yeah.
Okay.
Most of the time, yeah.
Okay. But with this current partner, what you're thinking about condoms with him?
Well, because we are just seeing each other, so it doesn't. We don't need to use condoms.
Okay. Okay. So I'm a little bit, because I'm just sort of wondering, to clarify, sometimes you're saying you're just with him and you both agreed to it, but then sometimes you said you're not sure about him in terms of others. Like, so what you're thinking about that?
Well, I know he has a couple kids, and I know that he spends the night over at the kids' mom's house with the kids.
Okay.
And
How
he says nothing's going on,
Okay.
but
Not sure.
yeah,
Do you know anything about the mother?
no,
Okay.
no.
Okay. So you're just kind of wondering, how often does that happen that he's over there at night?
On the weekends that he gets the kids.
Uh-huh. How often?
So every other weekend.
Okay. Okay, so he's over there during the night for the weekends?
Yeah.
Every other weekend?
Yeah.
Okay. All right. And so, sounds like you haven't talked a lot about those specifics with him in terms of whether he's got other partners except this situation where he says he's staying with his kids?
Yeah.
Okay. Okay. And about his HIV situation or whatever?
Yeah. No.
Okay. All right. Well, let me see if I understand what you told me is your situation
Okay.
right now. You know, you're monogamous with this one guy for 4 months, and you're happy in this relationship.
Yeah.
And you're just seeing him, and you're not using any drugs, but do have some alcohol use recreationally, right?
Mhm.
And then for him, you think you're not sure about other drug use or
Yeah.
his HIV status.
Yeah.
Okay, okay. And you're not using condoms with him right now
No.
because you feel like you're just with him.
Right.
Okay, and even though you have some concerns maybe about what he's doing, there's nothing specific that you're
No.
worried about.
Yeah.
Okay,
Yeah.
great. So in this behavioral risk assessment scenario, we learned that Tess was in a relationship with one male partner for the previous 4 months. And she's kind of a little ambivalent in asking her about whether her current partner has other partners. She sometimes thinks he doesn't, but then sometimes wonders if he does because he is involved with his children and the mother of his children and does sometimes stay at her home. In terms of substance use, she's using alcohol recreationally. She thinks that he uses alcohol too recreationally, but is not sure about other drugs. She's never had an HIV test, and he's never had an HIV test. So in terms of her attitude towards condom use, she's not using them with him, and she sees no need to use a condom because she's just with him. This would be a stage we call pre-contemplative, where a patient is not even ambivalent about whether they're using condoms or not, but in fact see no need to use a condom. That would be pre-contemplative stage for condom use with her one regular partner. So Tess, I want to talk to you just a little bit more about what we talked to everybody about prevention, you know, from getting HIV or other STDs.
Okay.
And I know we just, you know, you just talked to me about your partner situation. And sometimes I think it's helpful if we sort of sketch out what is that situation.
Okay.
So you told me, obviously you're here, we designate that by the symbol for the female, and then you have one male partner for that 4-month period, right? That
Right.
you talked to me about. And you don't have other partners.
No.
But you do know that he is involved in a relationship with the baby's mother.
Right.
And that sometimes he stays over there. What do you think her situation is in terms of having other sexual partners?
Well, he does, you know, I hear rumors. So, I mean, I think the reason they got divorced was because she was messing around on him.
Okay.
So,
High
that's why,
likelihood?
yeah.
Okay.
So that's why I don't even want to trust that. I don't even think that he would sleep with her when he goes there.
But you're not
But-
sure.
I'm not.
Okay. All right. So let's just say maybe she's got a couple of other partners, like in the
Okay.
last 3 months or something, like during the time that you've been with him, like 4 months.
Okay.
Okay. And just say that there's some question here, although, you know, you're not really thinking that he's definitely sleeping with the baby's mother, but you have a little bit of question because he stays there. Okay.
Okay.
So, you know, you said also that you really don't see a need to use condoms, even though you have used them before, because really you're just with him at this point, and maybe at other times you had other partners, or, you know, not really just in a monogamous situation.
Right.
Okay. And, you know, mutual monogamy, being with someone who's just with you, if both people are negative, know that they're negative for HIV, is a strategy for safety, right? So that
Yeah.
is a good strategy. But mutual monogamy does require, you know, to be safe, that the other person is not having other partners, you know? So I just want you to think about that scenario in terms of what you're involved in. And you said he's never been HIV tested, right?
Not that I know of.
Okay. And so, you know, we don't know if she has or not, right?
Right.
In terms of whether she's been HIV tested. But, you know, she does have other partners.
Yeah.
So just tell me, like, just hypothetically, what if it's possible that she might have HIV?
Does that mean that I can get it?
Well, that would be a scenario if he were involved with her or had been involved with her. Because you said that he hasn't been tested, right?
Yeah.
So I'm just saying, it is sexually transmitted. So in the scenario that maybe he's not seeing her now and he's over there just hanging out with his kids, but he was seeing her at some point, obviously, right, in terms of a sexual relationship.
Mm-hmm.
So without knowing, what do you think of the possibility of this?
It means I better go have a conversation with him.
Mm. Like if that were the case, how would that impact on you, do you think?
I mean, I could get it.
Test monogamy is a way that women often get HIV because they are in fact only with one other partner like you, and they see monogamy as safe. But sometimes monogamy is how people get HIV because they are monogamous but their partner's infected and they just don't know. And sometimes the partner doesn't know, right?
Yeah.
HIV, can be around for over 10 years without any symptoms, without any kind of medical, problem.
Wow. When you draw it out like that, it looks a lot different.
Sure. Well, in your mind, you see him. That's the one you're involved in, right?
Yeah.
Yeah. So you said you think you might have a conversation?
I know I will.
How do you think that will go for you?
Well, if he likes me enough to continue dating me, we'll go get tested together.
Yeah. And a strategy is also that, we in New York State have a law that is recommending that everybody, over age 13 basically, get a test for HIV to know their status. So sometimes instead of bringing it up anything around his situation with her, is to say, I went to my OBGYN and I had an HIV test today and they said everybody should be tested and here's information you could give to him and say, how about for you two? How about we both get tested or something? We both know each other's status.
Oh, that's a good idea. Then I'm not bringing up any question about what he might be doing.
Right. Yeah, some people find it to be less threatening,
Yeah.
because it is literally recommended for every adult.
Oh, okay. That's a great idea.
And what do you think about any protection in between, or is that something you want to think a little bit through?
I think that maybe we should start using condoms until we know.
How do you think that will go?
I'll have to think about how I'm going to
Yeah.
approach that one.
Yeah. Sometimes, it could be approached in terms of using a female condom.
Oh,
Do you know
okay.
about female condoms?
I've heard about it.
Okay. Well, it's something that the woman puts in, the vagina before sex. And the
Okay.
man, you can put it in, several hours, a couple of hours before.
Mm-hmm.
And the man doesn't have to be involved in the decision about that. Women use it for birth control. But it's
Okay.
something that, could be a short-term measure while you're figuring out, his testing and maybe what's happening with the baby's mother.
Okay.
Does that sound okay?
Yeah.
Great. We'll
Thank
talk
you.
about it more when you come back for your test results.
All right. Thank you.
What you just saw demonstrated was a behavioral counseling strategy that matched Tess's stage of readiness for change. So when we did her behavioral risk assessment, she was pre-contemplative for condom use because she saw herself as monogamous and was not really exploring too much whether her current partner, whom she's been with for 4 months, is involved with his baby's mother or not. So we needed to use a strategy that matched her pre-contemplative stage. She saw no need to use a condom because she's monogamous. So we used a stick figure type of a strategy, which is to explore the relationship status, showing the whole picture to the client. And so we drew out a little scenario with her and her current partner, and then the mother of his children, and then her scenario, which the patient perceived was that she does have other sexual partners, the baby's mother. So then we introduced the concept of possible HIV in that scenario because the patient did not know her partner status and obviously not his baby's mother status. So with her sort of seeing it differently, because she saw if he had HIV previously from having been involved with the baby's mother, he could have that unknowingly, and she saw that as putting her at risk potentially. So she is willing to explore getting tested with him and possibly using a female condom as a first step while she's exploring working with him to get his HIV test as well as hers.